Okay, gang, let me just go ahead and talk about the next two categories on the NCLEX test plan, because they're not very long, and I'll just knock it out of the ballpark here. Alright? So, the third category on the NCLEX test plan that I'm going to explain to you is health promotion and maintenance. Health promotion and maintenance category makes up about 12% of the NCLEX examination. Questions under this category deal with birth control measures, pregnancy, labor and delivery, care for a newborn infant, growth and development, and diseases that can spread easily like sexually transmitted infections. So you see how health promotion and maintenance is mostly, I would say, your core or basic nursing. So if you're not good with OBGYN, which would fall under like women's health on my 9 system review, buy that portion. If you're not good with pediatrics, get that portion. Okay, remember I told you didn't have to get the whole 9 system review. You can just buy the parts that are you're weak in. And this is exactly why, because of questions like this. Okay? If a patient is pregnant, it is very important that the nurse be able to act as teacher or counselor for the patient. That's very true. This makes it necessary to understand all components of the patient's pregnancy. Don't worry, LPNs. I know you're being told that you can't teach, okay? But that doesn't mean that you don't do anything at all, alright? Because you can act as a counselor. You can direct them to the right people, you know? So, don't worry. This is why I help the LPNs as well. When I first started my website back in '97, I was only going to help RNs, but the NCLEX is so similar between the LPN and the RN that if it's different and you purchase a seminar, I will say where it's different. Okay? I'll say, hey, this holds true for the RN, this holds true for the LPN. But it's so similar that I'm able to easily differentiate and point you in the right direction whether you're an RN or an LPN. So don't worry about this. I often get asked, is this for the RN or the LPN? Answer, both. If it's different, I'll differentiate verbally to you. Alright? And that's, again, no secret. I've been doing that for years. It really works well, guys. Okay, this category, health promotion and maintenance, knowledge of a proper diet. Alright? This becomes important because, like, Jewish people eat kosher food. High blood pressure, that would be a cultural issue, by the way, right? If a person has high blood pressure, they have to have a low sodium diet. If a person has diabetes, they have to have, obviously stay away from carbohydrates as much as possible. Okay? So this, again, knowledge of a proper diet not only entails a diet as far as your certain disease, but your diet as far as your certain culture or your certain religion or your certain spiritual beliefs. Again, this is best explained in tutoring sessions. Development of the fetus, okay? Signs and symptoms of pregnancy complications and certain pregnancy-related procedures will be helpful for this section of the exam. Again, health promotion and maintenance takes up about 12% of the NCLEX. Such contents would include, but not exclusive to, the aging process, high-risk behaviors, anti, intra, and postpartum newborn care, lifestyle changes, developmental stages and transitions, self-care, otherwise known as activities of daily living, ADLs, if you see that on the NCLEX, health promotion, disease prevention, techniques of physical assessment, and health screening. All of these topics would be under health promotion and maintenance. Again, like I did in my other videos, I'm going to close by saying currently how the NCLEX test plan has changed or stayed the same. Management of care has increased by 1%. Safety and infection control has increased by 1%. Health promotion and maintenance has stayed the same. Psychosocial integrity has stayed the same. Basic care and comfort has stayed the same. Pharmacological and parental therapies has decreased by 12%. Has decreased by 1%, but still it takes up a big chunk of the NCLEX. Alright? Reduction of risk potential has decreased by 1%, and physiological adaptation has stayed the same. Again, if you would like your current test plan, RNs, go to my website, caringforyou.net, click on the web page that says RN at the top. It'll be down in the middle of the site on the right hand side. LPNs, click on LPN at the top of the page. Your LPN test plan will be down the middle of the page on the right hand side, and they will be updated there, not here. Okay? Alright, I have to go answer this call. I'll be right back with the last section, which will cover psychosocial integrity. Alright, again, this is the third of the NCLEX test plan explained. Thanks, gang. Be right back.